Hi, I'm Dr. Matt B, and these are your emotional minutes. And I actually just gave a lecture here on how to select for grad school if you want to go into the mental health field. Now, this is something I do every semester, and really it's because as a field, I love working in the mental health field, but as a field, we just suck at really trying to educate about what the options are. And it can be really overwhelming because there's a lot of different degree types. Do I get a PhD? Do I get a Master's of Clinical Social Work, a marriage and family therapist? Sort of how do I choose? How do I choose where to go based on what I want to do in my life? Now, a lot of people feel like they have to get a PhD in clinical psychology because either that's kind of the first thing they think of when they think of the mental health field, or they want to impress people or impress their parents or whatever the reason might be. But a lot of times people are sort of fixated on that option, and going into the mental health field, whether you want to do treatment or research, really does take a graduate degree, but there's so many options out there, and the PhD is just one among a number of them. So today we're going to talk about how to choose. How do I choose which degree type to go for? Now, the first thing to do when you're trying to figure out which type of graduate school to apply for if you want to go into the mental health field is really to ask yourself a couple key questions. The first key question is really, what am I interested in? What types of things do I see myself doing? So do I want to deal with or work with psychological processes, things like thoughts, emotion regulation, or am I interested in how family interactions or social interactions might affect mental health, or am I interested in how issues that come up in society or sociological issues affect mental health, or maybe it's biological processes. Maybe you're interested more in how the body works, or neurochemistry or brain chemistry and how those things unfold. And the second question to really ask is, what do I want to do when I grow up? Really, what role do I want to play when I'm done with graduate school? So, do I want to be a researcher and research certain psychological phenomenon? Or maybe it's, do I want to be a researcher and understand more about biological processes in the brain and neurochemistry and medications? Or do I want to, be a therapist in an outpatient setting or even an inpatient setting potentially, where I'm predominantly, conducting psychotherapy or counseling services? Or do I want to conduct assessment, for example, things like intelligence tests, memory tests, things like that. So really sort of understanding, sort of what the role you want to play is, and even where you might want to do it, the type of setting you want to be in, can really help inform the type of graduate school you might be interested in. Now, there's so many different types of degrees that you can choose from, and really asking yourself these questions can kind of help inform which direction you might go or which degree program you might apply to. So the difference first between PhDs and some of the other degrees is a PhD is really meant to be a research degree, where you actually get a research training, and then you're trained to sort of eventually conduct research studies on your own, whether that's through a research lab or you're conducting research in a hospital or some sort of kind of medical or clinical setting. And really that degree entails a lot of research training. So during training, you're doing at least one research project, your dissertation, but oftentimes more. And that degree can actually be pretty rigorous, where you're responsible for doing research, but then also for doing clinical work. And so the average time frame for a PhD in clinical psychology is 5 to 7 years. Now, sometimes people will ask about the PsyD degree, or a Doctor of Psychology, and really that degree is meant to be sort of a clinically focused degree, meaning somebody's going to focus on treatment, whether in an outpatient setting, conducting psychotherapy, or conducting assessment, or both, or some sort of inpatient setting. And that degree is really designed to be a clinical degree, but it's trained to be sort of a consumer of research as a PsyD. So you're trained to sort of use research and use research information to understand how to treat your patients or clients. Some of the other degree programs that allow for treatment in mental health are things like the clinical social work degree, or a Master's of Counseling, or a marriage and family therapy degree. Now, these degrees really all require some sort of clinical work to get through, a clinical training, but are really meant to be a clinically or a treatment-focused degree. So I often steer people in this direction if they know they just want to do sort of predominantly treatment work, because these degrees can sort of really just focus on that, but then also get you out the door a little bit sooner, and you end up spending less time in grad school. So as it comes down to those different degrees, and sort of wondering, okay, what sort of things am I interested in, or processes I want to focus on? For example, like a clinical social work degree tends to be sort of influenced by a sociological perspective. So how do issues of community, issues of sociology, things like that, how do those affect mental health? Not exclusively though, that perspective will sometimes train in other areas as well. A marriage and family therapy degree will focus on family interactions and upbringing and how those things affect people's mental health. Oftentimes people think of family counseling or marital counseling, and an MFT, a marriage and family therapist, will do those types, but they also do a lot of individual counseling as well. And then a master's of counseling typically might come from a number of different perspectives or look at a number of different processes, and that just kind of comes down to typically the training program and what sort of faculty are there and what they specialize in. Now, if you're interested in things like biological processes, how sort of neurochemistry functions and how medications can benefit or help people with mental health difficulties, then you might be interested actually in medical school, trying to get a medical degree, an MD, and then working in some sort of inpatient or outpatient psychiatric facility, or have a psychiatric practice where you're prescribing medication or doing psychiatric research or some combination of those. Another route that people will sometimes go if they want a little bit more of a medical orientation, and they might want to work in, say, like a inpatient hospital, mental health hospital, or an outpatient hospital, would be to go into nursing, because you can go into nursing and then specialize in psychiatric nursing. And nurse practitioners, psychiatric nurse practitioners, also will prescribe medications in the mental health arena. Now, my degree is a PhD in clinical psychology, but in all honesty, I actually really usually try to tell people to steer away from that, unless they're interested in a research career or having an intensive research training. And really the reason for that is, again, sort of the long road it takes. It is a long road, and it involves a lot of research projects. And if that's not something you're interested in or something you don't really like or enjoy doing, then it's just kind of going to be a miserable time. I mean, it's going to be like chewing glass. You're just going to be spending even periods of years working on something you really just don't want to do or don't like to do. But if you are interested in research and you also want a clinical training, then a PhD in clinical psychology could be right for you. And that degree usually typically takes some research training, at least to be competitive, to get into that type of program. So, working in a research lab for a while as an undergrad, for example, is a helpful thing. A PsyD degree is a doctoral level degree, again, focusing on treatment. But experience you might need getting into that sort of degree might focus more in sort of the treatment area, or working, say, in some sort of mental health agency, or working as a mental health tech at a mental health hospital or residential treatment center, something like that. Usually that degree takes about 3 to 4 years to complete. For that degree, also research experience is valued. And then for one of the other degrees, the Master of Counseling, Clinical Social Work, or Marriage and Family Therapy, those degrees usually take about 2 to 3 years to complete. And usually, having that kind of clinical experience, say in mental health setting, is really helpful for your resume. And they also look at research as well if you have that sort of experience. Hopefully that was helpful today in talking about the different degree programs, and hopefully it gave some good information on how you might sort of navigate that process or choose which degree programs you might apply to. Now, if you're interested in either specific programs or the specific process of applying, so for example, who do I seek recommendations from? What sort of experience do I need specifically? How do I tailor my personal statement or essay that I write to those programs, and all of those things about the application process. If you're interested in those, I'll leave some links in the post to some really good resources. So again, I'm Dr. Matt B, and these are your Emotional Minutes, and good luck, and we'll see you next time.